According to AARP, 1 in 5 caregivers reports a high level of physical strain. 2 in 5 consider it emotionally stressful. But as the Mitchell family found, planning ahead can help ease the tension for everyone.
Way forward, Mom.
Life isn't always like the movies, but at the theater at Tiger Place, Joyce Mitchell has found the perfect escape.
I enjoy it immensely.
The 86-year-old decided to move to a retirement community after her husband Roger passed away in 2013.
I didn't want to shovel the snow and I didn't want to mow the grass and, all the basic housekeeping things I didn't want to do anymore, and by myself.
Over 57 years of marriage, Roger and Joyce traveled the world together, but they also talked about retirement communities and where they'd live when the time came, making plans that proved to be a blessing for their 4 daughters.
They were probably in their early 70s when they started talking about it seriously and visiting places. They had some health issues, but it wasn't looming.
It's something Dr. Karli Urban, a geriatrician with University of Missouri Healthcare, recommends.
None of us, early on, unfortunately, kind of know what the future holds, but there are certain things that all of us really need to do.
Dr. Urban says it's important to make living arrangements and get your legal paperwork in order before there's a crisis situation.
I encourage people to look at it not so much as a depressing thing to do, but more of a great way to make your wishes known to your loved one. So I encourage people to sit down and just say, hey, what's important to you? What would you like?
For the Mitchells, having those discussions paid off.
I think she took to it so well and so quick that I never did worry about her here. And I saw her happy.
Happy and safe in her new home. Joining me now is Dr. Karli Urban, a geriatrician with MU Healthcare. And when it comes time for those tough conversations, emotions can be pretty high among family members. What can help?
I think a lot of times incorporating the physician into that discussion is very helpful. Oftentimes they have their perspective not only medically, but they've been able to see how that patient has progressed over time. And I think a lot of times it takes some of the emotional part of making those decisions out of it, or at least contributes another facet that you may not otherwise look at. So incorporating them early is very helpful.
Good advice. MU Healthcare's Family Caregiver Conference is August 16th. Who is that for and what will they expect to learn?
It's designed for informal caregivers, so that's often someone who cares for a spouse, a parent, or maybe a neighbor, another loved one. They are going to gain education about what to expect in that caregiving role. They'll have access to resources here locally and regionally that may be beneficial to them. And then also the network of support I think you get from being around other caregivers is priceless. So they will get all 3 of those.
Great. Thank you very much.
Thank you.
Dr. Karli Urban. And with Focus on Your Health, I'm Teresa Snow.